Joining us now to give his expertise on this complicated situation is Dr. Richard Mccormick, an emergency room physician who's been treating COVID-19 patients in Georgia. McCormick is also a Republican congressional candidate running for the state's 7th congressional district. So, Doctor, I first want to get your experience when it comes to your response to the COVID-19 pandemic. I know that each region has a very different response. They've seen a different surge or not surge depending on where you live. What's it been like from your experience?
Well, I'm glad you brought it up as a clustered effect. In other words, it's very different in different regions of the United States. That's so important to realize when you talk about government shutdowns and how you treat this disease. We did have our spike probably about a month or two ago. Since that time, actually, since even the opening of Georgia being one of the most preeminent states to open up at the start of this, getting back to work, we have not seen a second surge, which is so important to realize. To not see a second wave, which we did expect. Even the most skeptical people thought that there would be at least some sort of bump, but there wasn't. The numbers continue to go down despite testing more patients. The admissions go way down, and the ICUs are clearing out. In other words, the patients who were the most sick before are now coming off the ventilators and being discharged, which is fantastic news.
And when we look at the different states that have made that decision to open up, we can look at Florida, we can look at Texas, you can go through them and kind of see that there hasn't been that surge that a lot of people were warning about at first. And that's not to say that we won't have one. I'm not a medical professional. I can't speak as to what the future will hold or anything like that. But what is the lesson that we can learn from this? Is it the idea that maybe this disease isn't as transmissible as we initially thought? Is it that maybe there's more herd immunity in this country than we thought? What can we take away from that lesson?
So we're still learning exactly what the prevalence is. In other words, how many people have been exposed. My theory, based on just the evidence that we see firsthand, is that we probably do have a herd immunity. If you look at the studies of the contained spaces that we actually knew had overall exposure, such as the Navy ship that had wide exposure, or the cruise ship that had wide exposure, these nursing homes that have wide exposure, you can see the prevalence of this disease is very contagious. But the vast majority, especially of young, healthy people, are not getting sick. As a matter of fact, more often than not, in young people, you have zero symptoms, even though you're building an immunity. Even in the elderly, the most vulnerable populations, they've shown that almost 50% of the people who actually are exposed to this and are building some sort of immunity don't have symptoms, at least not significant symptoms that we would acknowledge. And then of those people that are coming in, we're getting much better at treating the disease too. So the overall outcome is not as high in mortality.
And that is so important because we've been talking about the crisis taking place in our country's nursing homes, whether it be in New York or really any states. That's where a majority of the deaths are coming from. And new numbers suggest that maybe it's even 40% of the deaths taking place in the U.S. are taking place in nursing homes. And that's very problematic for me because it's the government's job, in my eyes, to take care of the most vulnerable people, especially when we know that this virus does affect people with comorbidities, people who are more vulnerable populations. And one thing that's kind of entered this equation is the use of this drug known as hydroxychloroquine. Some people say that it's not effective as a treatment. Some people say it is effective as a prophylactic. There's different studies really that you can find online to support whatever position you want to take. Where do you stand on the use of that malaria drug?
Yeah, that's the problem, is that there is a lot of contradictory information out there. Until we get the double-blinded placebo tests with multiple patients, I mean, I'm talking tens of thousands of patients where you're able to compare it to not only placebos, but also other drugs, because we have remdesivir out there right now. Right. We actually have multiple drug combinations we're using. We'll be able to compare and contrast which drugs are most effective. Right now, I mean, up to now, it's been our standard of care. We do have some new trials being started. I think mechanically, it's more important to realize how we treat these really, really sick patients, because those are the ones that are potentially going to die. Understanding that we shouldn't be intubating them, we should be putting them in prone position and putting nasal cannula on them instead. But yeah, I have no problem with hydroxychloroquine as it stands right now until we show clear evidence that it's not good for you.
And when you say that you use it, are you saying it is a treatment or something maybe a little bit more beforehand as a preventative measure? Is it something that's used depending on the situation? Is that really the way that doctors should be approaching this?
Yeah, so a lot of people think that it can be used prophylactically or preventively, as you were saying. Ivermectin is another drug that they're testing in India, along with doxycycline, which are antiparasitical drugs. There's a lot of combination of drugs. Using zinc, which is known to be good for viral replication inhibitors. There are lots and lots of drugs. Right now, I have no problem. It's a very safe drug. I've used it myself when I was in the military. We were in malaria areas. I'm not worried about the side effects of this drug unless you have serious heart conditions or there's some other cross contamination or cross reaction with another drug. But I'm not worried about it harming you. I think anybody who's saying that is mostly politically motivated.
Yeah, and that's good to hear because usually when we are talking about this drug, it comes back to President Trump somehow, and I don't think that is the conversation that should be having had on the media. I think it's the effectiveness of this drug. You should leave politics out of it. Unfortunately, that's not the environment that we live in today, so that's not the conversation that we're hearing in the media either. But Dr. Richard McCormick, I really appreciate you coming on tonight, breaking down this whole complicated issue of coronavirus for us. Thank you.